So good morning everyone. Today we are going to see about the routes of drug administration. So first of all, what are the routes that are used to administer the drugs? So what is the purpose why we are selecting these routes? So first of all, the route of drug administration is a path by which a drug or substance is brought contact into the body. So next we are going to see about the classification. So in that we have two major classifications. The first one is systemic and the second one is local. So in the systemic we have another two subdivisions, enteral and parenteral routes. Enteral routes we have oral, sublingual and rectal. Parenteral routes we have injections, inhalations and transdermal patches. So in injections we have so many routes. So the first one is intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, intrathecal and intradermal. These are the different routes of injections. So next is a local. So in local we have a topical skin ointments, eye drops, nasal drops like that. These are the routes of local administration. And the next one is inhalational and transdermal patches. So first of all, what are the factors that governing the choice of the route? So why we are selecting the particular route for the particular group of drugs? So what is the purpose and the factors? First of all, first the factors come from the properties of the drug, physical and chemical properties of the drug. Next is the site of desired action of the drug. Third one we go on to the absorption. And the fourth one is effect, accuracy, rapidity and the condition of the patient. For unconscious patient, we can't take as a oral route. So we only proceed to the IV route. So these are the five major factors why we are selecting the particular route of drug administration for the patient. So the next one is enteral route. So in that oral route we have advantages and disadvantages. The advantages first of all it comes from the convenient. So it is a self-administrative and the absorption takes the whole length of the GIT and the compared to the injections or patches it is very cheaper to cost. So what are the disadvantages means some drugs are very unpleasant in taste. So we can't use this route for the unconscious patient. So that is a major disadvantages. So on the it is or emergency conditions we can't take this kind of route. So next is the sublingual. So sublingual administration is that the drug or tablet form should be placed under the tongue. So the rapid absorption will be there. So the advantages is like it is economical and the first pass metabolism is avoided in that. The disadvantages is some drugs may be irritative and the few drugs only absorbed. There is an so next is the rectal route. So the drugs are administered rectally. So in these conditions, the outer surface of the drug is mixed with the waxy substances that dissolves or liquefies when after it is inserted into the rectum. So the disadvantages is it is inconvenient to the patients and the absorption is also very slow and it may cause irritation or inflammation of the rectal mucosa. So the advantages is used in the children, so no first pass effect. Vomiting or unconscious conditions we can use this and there is a higher concentration. So next we are going to see about the what is a first pass effect. From the first slide we are seeing that first pass effect, first pass metabolism. So what is that? So the first pass effect means it is a hepatic metabolism of the pharmacological agent. So pharmacological agent mean here they mention as a drugs. So particular group of drugs what we are taking. So the pharmacological agent. So what is the first pass effect occurs first of all in the it is absorbed from the gut and delivered to the liver via portal circulation. Once there will be the greater absorption, I mean the greater first pass effect, the lower the bioavailability. So bioavailability means the rate and effect of the drug which reaches the systemic circulation. So once there is a greater absorption, so the bioavailability will be less.